Welcome to Module 4. This module covers Chapter 4 from Nutrition Counseling and Education Skill Development. In this module, we will talk about the different steps occur during a regular nutrition counseling session. We will also discuss different models regarding nutrition counseling. So first, let's talk about nutrition counseling models. There are several models and algorithms regarding nutrition counseling. They help us conceptualize the counseling process. But remember, the actual flow of a counseling session will adjust to the skills of the counselor and to the needs of the client. So, different models and different algorithms, they just provide a framework, a structure for us. So this is a nutrition counseling model. And as you can see from the flow chart on the right side of the slide, there are several steps, and we will talk about those steps. So as I mentioned, these models, these algorithms, uh, help us visualize the major components of the total interaction between a counselor and a client, between us as a nutrition counselor and a client. And also, this model addresses the need for counselors to assume several roles throughout the counseling session in order to accomplish counseling tasks. In general, a nutrition counselor uh, reviews medical records, food patterns, medication intake, health history, socioeconomic conditions like income level, education level, and other factors related to our client. So we will, as a nutrition counselor, we will obtain numerous information from clients, and those information will help us kind of tailor the session to the needs of the client, to the problems, to the issues of the client. So here, this model entails preparation step, explanation step, assessment, intervention, evaluation of client, and conclusion. And at the end, we will have a self-evaluation of counselor. So in the preparation step, this step occurs before the first session, during the first session, and periodically thereafter to understand problems, skills, and resources related to food intake and readiness to take action. And then we have explanation step, which is educational component. So in this step, we will, as a nutrition counselor, we will provide hands-on educational experiences. We will provide information, nutrition related information. Then we will have intervention, which is a treatment component of counseling. In this step, as a nutrition counselor, we will take on the role of problem solver and expert, and we will use different intervention strategies in order to implement dietary goals. And then we have assessment, intervention, and evaluation step. These are parts of each counseling session until the decision is made to conclude the program. And in conclusion, here we will again take on the role of an expert when we are reviewing major issues and the goals. And then we will have self-evaluation step at the end. In this step, as a nutrition counselor, we will take on the role of a learner. We will learn from our counseling experiences in order to improve our own counseling skills. So these steps can occur during each nutrition counseling session. So let's do this. What component of nutrition counseling models is the treatment component of counseling session? Explanation, intervention, assessment, or evaluation? Yes, that's intervention. So when we say intervention, it's the treatment component of counseling session. Besides nutrition counseling model, we have nutrition counseling motivational algorithm. As we can see from the flowchart on the right side of this slide, it also contains several steps, several phases. So we have involving phase, exploration, education phase, resolving phase, and closing phase. So we have four phases in this model. And the foundation of this algorithm is the fact that motivation is a pivotal force for behavior change. That's why we call it motivational algorithm, nutrition counseling motivational algorithm, or motivational nutrition counseling algorithm. So motivation is a key factor, is a key force for behavior change in this algorithm, in this model. And clients come into counseling sessions at varying levels of readiness to take action. So there are two kind of fundamental kind of foundation or basics for this algorithm. The first is motivation as a key factor, as a key force, and then the clients, they have different levels of readiness. They have different levels of kind of motivation. So according to this algorithm, we have three levels for resolving phase. So, since we have three levels of kind of readiness or motivation, we can assess that readiness. So there are different ways to assess the readiness of clients to take action. So we have three levels of motivation. We have three levels of readiness to take action. And these levels require a need to make an assessment. So level one is the clients at level one, they are not motivated and they are not ready. At level two of readiness, clients are unsure and they have low confidence. So they are in a ambivalence situation. They are in the ambivalence phase. And at level 3, clients are motivated, they are confident, and they are ready to take action. And remember, not all, this is a very important point, not all counseling situations follow a formal type of assessment, especially when monitoring on a regular basis. So there are different methods, there are different ways to assess, to evaluate the readiness, to evaluate uh, like whether clients are at level one, two, or three. So we can use different methods. The one is stage of change algorithm, which we see on the right side. So for this, in this method, we can ask several questions in order to determine the stage of change in order to adopt a specific dietary plan. For example, low-fat diet. So if we want to, let's say our client needs to adopt a low-fat diet, for instance, and we want to measure, we want to assess the readiness of clients to implement low-fat diet in their daily life. So we can use this methods. We can ask these questions. But remember, we can adjust this stage of change algorithm uh, in response to our, our goal, our, intervention, our treatment. The second method, the second way to measure, to assess the readiness or to assess the motivational level is readiness to change open-ended questions. So, for example, we can ask, how do you feel about making a change now? People differ in their desire to make changes. How do you feel? When thinking about changing food habits, some people may not feel ready, others may feel they need time to think it over, and some people feel ready to start making changes. What are you feeling? So these are the questions we can ask. These are open-ended questions, and we can assess the readiness. We can assess the motivational level based on their clients' responses to these questions. Um, and we have readiness to change graphic, which we can see here. We can show a graduated picture of a thermometer, ruler, or chart. So we can ask, how important is this change to you right now, from zero to 10? And zero, with zero being as not important, and 10 being as very important. So we can ask, we can like give this graphic, picture to clients and ask their, feeling about readiness to take action. We can also use readiness to change scale question. We can ask this. We don't need to show any graphic to clients, but we can easily, very simply ask this question. On a scale from 0 to 10, with 0 being not at all ready and 10 being totally ready, which number represents how ready you are to make this change? And we have dietary adherence assessment. Again, we can ask this question. 1 through 4 can be used to appraise adherence to a dietary protocol. Not ready is equivalent to never follow the dietary guidelines, and ready corresponds to always follow the guidelines. And we can ask this question, from our client. And then we have other method. It's assessment of importance and confidence, which is very similar to the methods of readiness to change graphics. So we can, again, we can use a ruler or chart, and we can ask, how confident are you about making this change? And with 0 being not confident, and 10 being very confident. So these are different methods, different ways to assess readiness. So this table talks about like the process of counseling and interview. And this table is based on the motivational algorithm, which includes, the involving phase, resolving phase, closing phase, and all those four phases. Um, Here it says overview of the counseling and interview process. So it is better to know the difference between counseling and interview. So interview means the collection of valid and accurate data, whereas the word counseling implies that the counselor is assisting an individual in making life-changing decisions. So that's the main difference between interview and counseling. So by doing interview, we are just collecting data. We are collecting accurate and valid and reliable data information from clients. But when we say counseling, we are trying to help individuals make life-changing decisions, help them, make lifestyle changes or food behavior, nutrition-related behavior changes. So this is an involving phase, which is kind of similar to engaging phase. So here we have like greetings and introductions. We will talk about that. I would like you to read these tables very carefully, but here we will talk about that, to talk about each phase in detail. So the involving phase is the first stage, is the first phase of each counseling session. It includes like creating relationship with client, such as greeting the client, establishing comfort by making small talk, opening the session by identifying the client's goals and long-term behavioral objectives, and explaining the counseling process and making the transition to the next phase. So this is involving phase. This is engaging phase, which is our first step. So for the greeting, we need to like kind of um, convey this sense of warmth and caring to clients. Our tone of voice, our body language should also convey that we are happy to meet our client. And remember, the first impression is a lasting impression. The manner in which you and your client will address each other should be established. So, and here we have like different cultures. So it's like in some cultures, it is rude to call someone by their first name. So we need to also take that into account when we are meeting our client. In hospital settings, the greeting in clinical settings, in acute care settings, the greeting is totally different from a like a private nutrition counseling session. We need to also take into account the difference between a private counseling session with meeting a client, in acute care like setting. And when we have anyone accompanying us, we need to also introduce them. Um, and if there are friends or relatives with client, we need to also acknowledge and warmly greet them. So these are some key points regarding greeting the client, because this is a very important point, because in this phase we are building relationship, and we are develop trusting and helping relationship with clients. And then we should have uh, kind of we need to establish comfort by making small talk, like um, you know our goal is to create a private and quiet environment. And when the session has begun, we need to pay attention to our own comfort level, as well as that of our client. For example, if there is sunlight in the eyes or loud sounds from an adjacent room, we need to address that. We need to solve that problem. So small talk is also very important. So like after greeting, we can start talking about some, like weather, or we can provide a comment about the office or building. But we need to avoid uh, providing comment unrelated to the client or counseling experience, such as a current story in the news. We need to avoid that. We need to stay away from those comments. And then we have opening first session. We are kind of trying to identify the client's goal, so we can ask some open-ended questions. So like after greeting, after make sure that we have a comfort environment, and we have like a small talk about like weather, or about a office or a building. Like let's say, for example, we say, um, it is really beautiful out there. The weather is so great out there, for example. We can ask, after that, we can ask some open-ended questions. For example, let's say we want to say, what are you hoping to achieve in counseling? This is an example. What bring you here today? How can I help? So in this step, and remember, this step is part of involving phase. In this step, we are trying to understand the client's needs, expectations, concerns, and coping strengths. And we should emphasize on the following specific counseling approaches. Relationship building responses. For example, we need to respect, we need to show empathy, we have to have a reflective listening, and responses that indicate attentiveness and help clarify meanings. So we can use paraphrasing, summarizing, clarifying, and asking open-ended question. In subsequent session, an opening question. So, remember, in the first session, we are asking questions like, "What bring you here today?" But in subsequent session, we cannot ask this question. We can ask other questions. Where would you like to begin? How have things been going since we last talked? These are the questions. These are like open-ended questions we can ask in subsequent sessions. And also we need to, in involving phase, we need to identify clients' long-term goals, like general goals. Um, Remember, long-term goal or goals should be established in the first session and periodically reviewed thereafter. Goals can be general or specific. So general goal uh like clients say, I would like to feel better. This is a general goal. Or client says, I want to improve the nutritional quality of my food intake. So this is a general goal. This is not a specific. So we need to set at least one measurable long-term goal. Like, for a goal like I would like to feel better, this is not measurable, or I would like to improve the nutritional quality of my food intake. This is not a measurable long-term goal. This is a general goal. So we cannot measure that goal. So we need to set at least one measurable long-term goal, like keeping blood sugar levels below 180 milligram per deciliter. And specific goals are needed for measuring outcomes. In the first session, we need to explain the program and counseling process. So we need to, the client should receive in the first session, the client should receive the description of the assessment tools and what will happen in the course of the counseling program, the general statement regarding the issues that will be discussed, survey of possible intervention strategies and activities, frequency of meetings, correspondence by telephone, email, or text messaging. We need to discuss confidentiality. We also need to kind of provide a counseling agreement form. We need to clarify, this is very key point. We need to clarify our role as a nutrition counselor. We need to kind of, uh, you know, uh, inform our client that our role is to provide kind of support and inspiration, and our intention to work with the client to make decision. And we need to kind of, clarify that this is the client's responsibility to make lifestyle changes. That's not our role to make those changes for them. And we also need to review what our client is hoping to receive from a nutrition counselor. So this is an example. As a counselor, as a nutrition counselor, we can say something like, as we start the counseling process, I would like to share with you my hope of how we will be working together. I see myself as a source of information, support, and inspiration for you as we work together to find solutions for your issues, and so on and so forth. So, in the first session, if the client wants to lose weight, we need to discuss how to handle weight monitoring. But if weight loss is not an objective, there is no need to discuss weight monitoring. And remember, there is no solid rule regarding how often dieters should weigh themselves. And discuss with your clients if they would like to weigh them and how often. The focus of sessions should be on making changes that allow weight loss to occur, not on numbers on the scale. And also, we can use other parameters of health to monitor health status. For example, waist circumference, percent, body fat, blood pressure, cholesterol level, hemoglobin A1C levels. In some cases, these values, like waist circumference, percent body fat, blood pressure, they may be more responsive to lifestyle changes than numbers on a weight scale. And finally, we need to set the agenda in the first session. So we need to establish and agree with the client as to what will be covered in the counseling session. This should happen in the first session. And in the subsequent session, we need to review the notes regarding previous sessions. We need to ask the client for any issues they would like to address, explain your intentions for the session, and then come to an agreement on an agenda. And finally, at the end, we need to kind of doing a transition to the next phase. So before entering into the exploration or education phase, which is our second phase, we need to make a statement indicating a new direction. For example, we can say, now that we have gone over the basics of the program, we can explore your needs in greater detail. This is kind of a statement for transitioning to the next phase. So the next phase is exploration and education phase. So in this phase, we need to work with client to understand their nutrition and lifestyle issues. We need to search for strengths to help address difficulties. We need to assess readiness to take action. So remember the assessment tools we covered in previous slides. It occurs in this phase. We need to assess their motivational level by using different methods. And in this phase, this is exploration and education phase, we can provide educational experiences. And remember, in this phase, we need to provide a non-judgmental environment. Our verbal and non-verbal behavior should be viewed as curious rather than investigative. And our responses to advance exploration include open questions, open-ended questions, paraphrasing, reflection, probing, and directives. So for the educational activities, we need to address health risks associated with our clients' eating pattern. And we also should provide some sound bites of information. And the educational experiences of subsequent session should be geared to our clients' needs and desires. So, regarding the assessment, assessment is an important component of the counseling process. For the assessment in the first session, um, which is our, again, as I mentioned, assessment occurs in the second phase. But in the first session and in the second phase of nutrition counseling model or algorithm, this assessment should tailor an intervention according to the needs of a client. You can see chapter 5 for basic and common dietary and physical assessment procedures. When we are collecting information, when we are assessing our clients like dietary and physical aspects of their daily lives, uh, we shouldn't react with advice or criticism or praise or judgment because this could inhibit disclosure. We also encourage discussions at certain points to allow clients to provide insight about their life experiences. We can use at least 10 minutes of open-ended questions and reflection responses before beginning a structured assessment. Sometimes counselors needs clients. They have clients complete assessment or screening forms before the first session. This will save counseling time and this will allows clients to focus ahead of time on issues and counseling expectations. So, for example, as a counselor, we can say, thank you for completing these forms. The information in them will be helpful as we work together to search for solutions for your for food problems. I'm wondering what came to your mind as you were filling out these papers, and so on and so forth. We can ask some, open-ended questions. So I remember when we ask clients to complete assessment and screening forms before the first session, we shouldn't go into detail about the questions themselves. but we have to encourage open discussions of what the experience was about while they were filling out the forms. So these are some appropriate topics to explore with clients. We can discuss health risks associated with current eating patterns, concerns about changing food patterns, past lifestyle change successes, past experiences of trying to change food habits, difficulties with making food habit changes in the past, strategies that worked or did not work, selection of education topics to address in future sessions. If we have enough time, like 6 to 8 minutes, we can also use a typical day strategy, which is very similar to diet history interview. So we can ask like, when we say typical day strategy, we can say, what time did you wake up? What did you do? For example, like that, which is very similar to diet history interview. So this strategy, this method encourages clients to drive the assessment discussion and to tell their stories. And the assessment in subsequent sessions. So that was assessment in the first session. So in the subsequent sessions, uh, remember, during the first session, assessment activities are the most intense because we are assessing physical components, dietary components of their life. We are asking several open-ended questions. We are having them completing like screening forms and nutrition assessment forms. So that's very intense during the first session. But in the subsequent sessions, we can also uh, make assessments to set new goals and to monitor progress. So, for example, we can say, please look at the picture of this graphic. What square would you pick to describe how closely you have been following your food plan? So we are assessing here in subsequent sessions. And for example, we can say, tell me something about the square you chose. Why did you choose the square you did? And we have to give non-judgmental feedback. Assessment results should not be simply handed to a client, but reviewed in a neutral manner without judging them, without criticizing them. We need to give only the facts, allowing the clients to make the initial interpretation. And if we have a great deal of feedback to provide, we can pause regularly to allow the client to process the information and to check for comprehension. So, for example, we can say your assessment indicates an intake of half a cup of vegetables a day. As you see, the standard recommendation based on the government guidelines is 2.5 cups a day. So we are just giving facts here, and we are kind of giving the opportunity to clients to make the initial interpretation. And here we are not judging them. We are not giving, like judgmental feedback. So we can ask simple open-ended questions to encourage a client to explore the meaning of the results through questions and personal reflection. So for example, we can say, what do you think about this information? Do these numbers surprise you? I have given you a lot of information. How do you feel about what we have gone over? Did you expect the evaluation to look different? And if client asks us for clarification or meaning, we need to present the information in a non-threatening manner by avoiding the word you. So, for example, as a counselor, we can say people who have a low intake of vegetables are at a higher risk for developing several types of cancers, rather than you have an increased risk of developing several types of cancers. Don't say you should really be concerned about these numbers. They increase your risk for developing cancer. So these examples kind of conveying a threatening, statement to clients. After an assessment and summarize, we need to summarize. After an assessment, we need to summarize what the client is doing well, problems identified in the assessment, any self-motivation statements made by the client, and ask the client whether the summary needs any additions or corrections. This is also occur in exploration and education phase. So we need to summarize after assessment. And as we said, in this phase, we need to assess the readiness to make changes, which were those three levels of motivational levels. As appropriate, we need to use a formal assessment for readiness, such as a continuum scale, which we saw in previous slides. And we also need to assess importance and confidence, as well as readiness. So here is an example. So in the resolving phase, so in the involving and exploration phases, the objective was to assist clients in clarifying problems and identifying strengths to themselves and to the counselor. Um, the direction of the remaining time of the counseling session will be determined by client's motivation category. So, as we said, clients at level one, uh, the clients, aware clients at level one, the counseling approaches will deal with importance. If clients are at level two, they have some confidence issues, so counseling approaches should deal with confidence issues. The clients who are at level three, the counseling approaches will deal with selection of a goal and design of an action plan. And remember, these are very important points. A client may be at one level of readiness for one particular behavior change, but at a different level for another behavior change. Counselors need to be flexible in their approach to accommodate fluctuations in motivation level that can occur during an intervention. So in level one, clients may have clearly indicated that they are not ready to change behavior or not doing well at attempting to change. A decision not to change should be respected. We need to respect our clients if they say they don't want to change. And remember, at this level, the clients do not need solutions. They need to know they have a problem. I would like to look at this table very carefully, and this one and this one. So level one is not ready to change. So as I said, at level one, clients indicated that they are not ready to change. We need to respect their decision. The major goal at level one is to raise a doubt about their present dietary behavior. And during an awareness discussion, emphasize anything positive that the client is doing that could be built on if a decision to change is made. Sometimes clients are not aware of the benefits of behavior change or the risk and consequences of their present dietary behavior. We need to like focus on personalized benefits. So we need to help clients reflect on specific ways that they would personally benefit or feel better from dietary changes. So for example, we can say increasing fruit and vegetable intake could be particularly beneficial to you to help lower your blood pressure and aid in your efforts to lose weight. Focusing on these foods is likely to have a positive impact on your occasional constipation problem too. And we can ask some key open-ended questions to explore importance of change and promote change talk. So here's are some examples for key open-ended questions to explore importance of change. And then we have summarize. Um, it kind of help reinforce what has been said, trying to gather various aspects of a discussion and encouraging clients to rethink their position. We need to ask the client whether the summary was fair and whether they would like to make any additions. And we need to offer professional advice if appropriate. So, well timed and compassionate advice can aid in motivating behavior change. In the ideal situation, a client asks for advice. But if that is not the case, we need to ask permission to give advice. So, this is an example how we are trying to, uh, ask for a permission and give diet options, different diet options. We need to express support if clients are at level one. We need to let the clients know that we are there for them to offer guidance and support. And this is an example how we can express support. At level two, clients are unsure and low confidence. So they have in an ambivalence, situation. Clients in level two category indicated that a diet change is possible. They know the problem exists, but something is needed to push the decisional balance in favor of making a change. And the goal here is to build confidence in their ability to make a diet change. We are emphasizing on self-efficacy here. The major task is to explore and resolve ambivalence. Clients at this level know they need a solution, but they may not have all the facts regarding the benefits of changing. Simple facts may be all the client needs to progress to a higher levels of readiness to change. And again, we can also here ask some key open-ended questions to explore confidence in making a change. So, and remember, the objective is to focus on confidence and barriers. We can explore ambivalence by examining the pros and cons. Remember, we need to use the words like and dislike or pros and cons rather than advantages and disadvantages or costs and benefits. We need to inquire if the client would like to examine the pros and cons. So, for example, we can say, many people find it useful to explore their likes and dislikes about this issue. Would you like to do that? We need to guide the client to examine the pros and cons of the present diet. What do you like about your present eating habits? What do you dislike about the way you are eating? We need to guide the client to identify the pros and cons of new or additional changes. What do you think you would like about this new way of eating? What do you think you would not like about making these changes? So these are some kind of examples on how to explore ambivalence by examining the pros and cons. So this is an also an example. For this level 2, we can also kind of asking some questions about imagining the future. So here's an example. Let us create a picture of the future. Imagine that you made all the changes necessary to lower your cholesterol level. What's the first thing you notice that is different? What else is different? How do you feel? What do your family or friends see you doing? Who notices that this happened? Are any small parts of this picture happening now? How would you like your diet to be in the future? We can also use this method. And also we can explore past successes and provide feedback about positive behaviors and abilities. And here's an example for that. This is also very important. We can encourage support networks. So we can ask clients, or we kind of encourage them to locate a support group. Even an online support group will suffice. And then we need to summarize ambivalence, summarize the client's ambivalence, and ask the client how they would like to continue. For example, we can say, what are your options? How would you like to continue? And we need to also choose a goal if appropriate. If the client would like to set a goal, we need to follow the guidelines for goal setting for level 3 clients and review the goal setting process. So this may mean buying low-fat milk instead of whole milk, or taking some active steps to increase awareness, such as reading informational literature. This is a reflection activity. I would like you to do that for your own practice. And the level 3, these are clients who are motivated, confident, and ready. For these clients, the counselor serves as a resource person, increasing awareness of possible alternatives for solving problems. And if possible, we can use past successes to find viable solutions. And the closing phase, which is our final phase in nutrition counseling, motivation, and algorithm, in this phase, we need to review what has occurred during the session. express optimism about the future and appreciation for any obstacles overcome to support the client's self-efficacy. We need to plan for the next counseling encounter, which could be a phone call, email, text message, or a counseling session. And this is a good time to use a partnership statement. And this is an example for a closing phase. There are different approaches for brief interventions, which is very similar to the four processes of motivational interview. So FRAMES stands for feedback, responsibility, advice, menu, empathy, and self-efficacy. So as we talked, after an assessment, feedback to clients is provided in a non-judgmental manner. And the counselor emphasized the client's right to choose to change and their responsibility for making changes. The counselor offers clear advice and a menu of change strategies. The counselor interacts with the client in an empathic style. The counselor offers hope for the future and enhances self efficacy. And as I mentioned, private counseling sessions is a little bit different from acute care settings or long-term care settings. So there are some tips for working with patients in acute care settings. Remember, in counseling sessions, in private counseling sessions, that is the client who, most of the time, that is the client who comes to us and try to like make an appointment. But in acute care settings, sometimes the patient is not aware that we are going to visit them. So each time we visit a patient, we need to introduce ourselves. We need to verify that we have the correct patient. Um, and we have to describe the purpose of our visit and explain how the patient will benefit from the consultation. For example, we say, "Are you Mary Edwards?" If the answer is yes, we need to introduce ourselves and then ask the patient what name they want to use. They want you to use. If you have an option to meet at another time, asking whether this is a good time for the meeting to take place is usually a good idea. Although time may be limited, so in acute care settings, the time is very limited. But we shouldn't disregard relationship building skills and rush through the interview.